India got freedom in 1947.
and it took 37 years to publish the first part of national health policy. It was in 1983 that the first national health policy was declared. It emphasized on Alma Ata Declaration and Health for All by 2000. The next revision of national health policy came in 2002, which emphasized on National Rural Health Mission. And the last third part of national health policy, which we are going to mention now, was first declared in 2015 as a draft. The national health policy statement was prepared in December 2014 and the draft was published in 2015. It is a 58-page document and is divided in 13 sections. The section 8 talks about medical technology, and section 8.3, 8.4, 8.5 and 8.6 talks about the topics related to it. The Pharmacy Council of India has commented on National Health Policy Draft 2015 on 11th February 2015. It is mentioned that there are 1,114 B-Pharm colleges with 73,618 intake, 777 D-Pharm colleges with 46,520 intake, and 190 Pharm D colleges attached to 150 hospitals and catering to around 45,000 patients. The Pharmacy Council of India's comment also mentions about strengthening of pharmacovigilance system. Eh, it mentions about 7 lakh pharmacists, out of which 6 lakhs in community and 1 lakh are in hospital pharmacy. Pharmacy Council of India document also proposes for National School of Pharmacy. The National Health Policy Draft 2015 has been finalized in 2017. There are 28 sections and it is a 31-page document. Section 4 talks about national health programs, where subsection 1 4.1 to 4.8 gives a list of programs which also has been discussed in one part of the book. Section 13.3 talks about corporate social responsibility platform. Section 13.5 talks about disaster management. Section 13.8 talks about role of immunization, role of pharmacist in immunization. 14.1 talks about strengthening professional councils like Pharmacy Council of India. Section 14.3 talks about food safety. 14.4 talks about drug regulation. 14.5 talks about 14.5 talks about medical devices regulation. 14.6 talks about clinical trial regulations, and 14.7 talks about pricing of drugs, medical devices and equipment. Section 15 talks about vaccine safety. Section 18 talks about availability of drugs and medical devices. Section 20 talks about manufacturing of essential drugs and vaccines. Section 21 talks about antimicrobial resistance and pharmacovigilance. Section 23 talks about digital technology ecosystem. Section 25.2 talks about drug innovation and discovery. The health expenditure on health is expected to be 2 to 3.5% of GDP, which actually is 1.04% presently. It is needed that the health expenditure by central and state government should be increased to around 2 to 3%. Health is a concurrent subject controlled by both by central and state government. Overall, National Health Policy 2017 document reflects addition of new technologies like digital health and emphasizes on medical devices, pharmacovigilance, manufacturing of essential drugs, and